A gradual destructive process begins with bacterial plaque buildup on the teeth. This sticky film irritates the gums, leading to gingivitis, the earliest stage characterized by redness, swelling, and bleeding during brushing or flossing. At this point, the damage is still reversible with good oral hygiene. When left untreated, gingivitis progresses to early periodontitis. Here, inflammation extends deeper, causing the gums to pull away from the teeth and form pockets. These pockets trap more bacteria, leading to infection and the start of bone loss around the teeth. As the disease advances to moderate and then severe periodontitis, the infection destroys more gum tissue and bone. The pockets deepen, bone loss becomes significant, and teeth will become loose and shift due to the lack of support. Chronic inflammation and possible abscesses further weaken the structures holding the teeth in place. In advanced periodontitis, the destruction is extensive. The gums recede, bone loss is severe, and teeth will become so loose that they either fall out on their own or require extraction. At this stage, tooth loss is inevitable, and restoration often requires dental prosthetics or implants. However, early stages can be treated with meticulous removal of plaque calculus from both above and below the gum line. Specialized hand instruments and ultrasonic devices that vibrate at a high frequency are used to break up and remove these deposits. The ultrasonic scaler also creates tiny air bubbles that help destroy bacteria, especially those that cannot survive in oxygen. During scaling, antimicrobial agents may be used to further reduce bacterial load. Root planing follows scaling and focuses on smoothing the root surfaces of the teeth. The goal is to remove any remaining toxins, bacteria, and rough spots on the roots that make it easier for bacteria to reattach and harder for gums to heal. By smoothing these surfaces, root planing encourages the gum tissue to reattach to the tooth, reduces pocket depth, and promotes healing. For more advanced cases, treatment may involve laser therapy. After numbing the area and measuring pocket depth, a laser targets and removes infected tissue while preserving healthy gums. Ultrasonic tools remove dislodged tartar, and a second laser pass sterilizes the area and encourages clot formation. This clot seals the pocket to promote regeneration of bone, ligament, and gum tissue without sutures.